Homeopathic prophylaxis. Homeopathic view of specific protection. It supports all the measures except immunization, where homeopathy has its own views and scope. Immunization by homeopathic preventive medicine. Homeopathic prophylaxis is often confused for homeopathic vaccination, but it is more than just homeopathic vaccination. Homeopathic vaccination is the use of homeopathic remedies against diseases either earlier in an epidemic or given routinely to prevent common diseases like chickenpox, measles, mumps, influenza. When latter is used, it involves mostly the use of nosode, just like any conventional vaccination, which administer the antigen in inactive state to gain immunity towards the disease and is given before the onset of diseases or disease symptoms in an individual as a prevention rather than cure. Homeopathic prophylaxis involve careful selection of individualized remedy either in epidemic or sporadic contagious disease to treat the symptoms. Homeopathic prophylaxis was effective since Hahnemann's time because the basic principle of individualization was used. Hahnemann used belladonna and aconite during the two outbreaks of scarlatina epidemic in Europe in early 1800. Immunity plays very important role in the spread of disease as children with lower immunity are more likely to acquire illness. The scarlatina fever rash is like this rosy red rash. Hahnemann tried to search the remedy which produced the same action in a healthy body as in a disease. Both episodes of epidemics were different. Hence Hahnemann individualized the epidemic symptoms and found a group of remedy that would suit the nature of symptoms in that particular epidemic, thus emphasizing on individualization. In the first epidemic, he used belladonna, and in the second epidemic, he used aconite. Thus, he proved his point and could not emphasize enough that no two epidemics should be considered the same and treated in the similar manner, since all the outbreaks are different and come with a different symptoms and intensity. Okay, homeopathic prophylaxis is two types: general and specific. Okay, specific means nosode, genus, epidemicus, and constitutional remedy. And specific homeopathic prophylaxis is and general homeopathic prophylaxis is done by the anti-miasmatic remedies. The selection of remedy for prophylaxis in a particular epidemic, genus epidemicus, can be done in three ways. First would be use of nosodes in prophylaxis. This approach can be useful before appearance of genus epidemicus or before epidemic symptoms are clear. The variolinum, tuberculinum, bacillinum, etc. nosodes used as a prophylactic measures. The selection of nosodes for the epidemic treatment is done by using the same disease genus to prepare the nosode that is occurring during the particular epidemic and not through individualization. This approach has limitation as it offers the prophylaxis only for a particular epidemic. The second approach is select a remedy or a group of remedies that have individual epidemic symptoms seen in patients. This is the same approach that Hahnemann used during scarlatina epidemic in Europe, where belladonna were chosen individually for each epidemic of scarlatina fever. The symptoms of scarlatina fever that were commonly seen among all patients with very little variability were then selected to find remedies. The common symptom: continuous fever, delirium, coryza, inflammation of pharynx with difficulty in swallowing, hoarseness of voice, and rash, rosy red. All these characters on scarlatina fever were more distinguished in belladonna than in remedies like arum, allium, drosera, etc. to have some of this symptom, but considering the totality of symptom, belladonna was selected at genus epidemicus. This genus remedy will be more helpful in providing homeopathic prophylaxis than the use of nosode. Is treating the patient with constitutional remedy. This approach works best when the genus epidemicus remedy and the prophylactic nosode remedy fail to provide the prophylaxis or to cure. This happens when there is an already existing chronic disease and the vital force is in a morbid state that it does not react to genus epidemicus. Thus, in such cases, the constitutional remedy selected through simillimum and totality of symptom works effectively. One can take any of these approaches to cure, but treatment is effective only when a practitioner individualizes each and every case, identifying the symptom of disease characteristic pertaining to unique totality of every individual case. In general, the lower potency stuff is commonly used. The potency are 12C or 30C, occasionally 200C, and on rare occasion 1M potencies are used in prophylaxis. It's ideal to give remedy in repeated doses of gradually ascending potency in a medicinal solution.